We have a very special show today. We have the first installment of the Providence Holy Cross Hour. Can we call it that?
That sounds great.
All right. And then we have Dr. Bernie Klein. He's the chief executive over at Providence Holy Cross. And how are you?
I'm doing great. How are you today,
And you're
Kyle?
really the host of this show. I just push the buttons back here. So,
sounds good.
Yeah. But let's talk about this since the first show. Let's introduce you a little bit. What is your background in medicine? Where did you go to school? All that fun stuff.
Okay, so I am a board-certified internal medicine physician. I went to medical school, Chicago Medical School, and then did internship and residency at Harbor UCLA Medical Center in Torrance, California. And from there, I did a medicine fellowship at the UCLA West LA VA Hospital. And then took my first full-time job at Kaiser Permanente in Woodland Hills. So I was a Kaiser physician, and that's when I actually got into administrative medicine. I was brought on board as a primary care doctor, and I was going to be the best primary care doctor anybody had ever seen. Unfortunately, there were some snafus in the system, and within 6 months, I had over 900 patients.
Holy cow.
In 9 months, I had over 1,600 patients. And the patients were frustrated because they couldn't get in to see me. I was frustrated because I couldn't figure out what was going on. And I was newly married, and I said to my wife, this isn't working. I'm going to write a letter. And she said, well, you can't just write a letter of complaints. You have to come up with solutions. So I wrote a letter, and what happened was in the system, in the computer system, they had my name 3 different ways. So they didn't realize they were assigning me so many patients. But I wrote a letter, I wrote some recommendations, and being a good organization, they put me in charge of the new physicians for the following year. And one of the physicians there kind of took me under his wing and started mentoring me. And I really liked the idea that I can affect a system that treats patients.
And so this was at Kaiser, you said?
This was at Kaiser Woodland
gotcha.
Hills. And so at that point, I thought, wow, I want to pursue this further. And so to make a long story short, my wife and I ended up moving to Atlanta, Georgia, where I also worked for Kaiser as a physician. And while there, I got an MBA at Emory University. And at Kaiser, started to do more and more administrative work for them. And then we had 2 kids, 911 hit, and it was time to come back home to LA. So I took my first full-time job at Los Robles Hospital in Thousand Oaks as their first medical director. I was there 3 years. My 3rd year, I was chief operating officer, and then I got the call to come to Providence, where I became the chief medical officer at both Providence St. Joseph Medical Center and Providence Holy Cross Medical Center. But wait, there's more. So I was happily doing my CMO job, and about 3 years ago, 2.5 years ago, we had a change in leadership at Holy Cross, and they asked if I would assume the chief executive position on an interim basis, which I did. And here I am 2.5 years later.
Yeah, I was going to say, that was 2 years ago. Yeah.
Yes.
Yeah.
So it's been quite a ride. Life tends to throw you some interesting curveballs, and you just try to go with it.
Did you did you always want to be in the medical field growing up and all that stuff?
Except for when I was very young and I wanted to be a trash man.
Okay, yeah.
I did want to be a physician at a very early age. I liked the idea that you could help people. I think that's part of my nature, and it's incredibly rewarding. What's interesting is, so as a primary care physician, I could help people one at a time, right? You see one patient at a time, and that's what you do. When you get into administrative medicine, you can affect the health of hundreds and thousands of people, and that, for me, is extremely gratifying. It's an incredible honor, and I'm very thankful.
That's cool stuff. So it seems like you may have been able to get a job anywhere with your experience. What stuck out about Providence? Did they contacted you, or was there something that stuck out about them that you were like, wow, this place is special? What stuck out about Providence?
I think a couple of things stuck out about Providence. One is it's a very mission, core value driven organization. So the mission at Providence is as people of Providence, we reveal God's love for all, especially the poor and vulnerable, through our compassionate service. And what's neat about the mission is it's not just words on the wall. We literally celebrate our mission, and we do everything possible to live our mission each and every day. In addition, we have several core values, and we constantly celebrate our core values. We recognize employees who have made exemplary efforts of demonstrating a core value, and I think that makes it's more than a job. It's more of a calling, and our employees tell us over and over why they like working at Holy Cross is because of the dedication to the mission and core values. In addition, we're nonprofit, and I've worked in the for-profit world at Los Robles, and now I've worked in nonprofit both at Kaiser and at Holy Cross, and there's a difference. There is definitely a difference.
I would think so. Yeah, I would think so. Okay, we're going to take a quick break. We're going to pay some bills. That's enough about you. Doc.
Excellent.
So we're gonna take a quick break, and we're gonna talk about some changes and stuff.
Sounds good.
All right, quick break. This is the Providence Holy Cross Hour on AM 1220 KHTS. This is the Providence Holy Cross Hour on AM 1220, and we're speaking with Dr. Bernie Klein. He's the chief executive over at Providence Holy Cross. And again, we appreciate you stopping by. And we wanted to talk about. We got into you a little bit. Now we want to get into the nitty gritty, the stuff you work on every day.
Good.
And I was wondering, so talk to me a little bit about, obviously the big thing happening in healthcare is healthcare reform, Obamacare, all that stuff. What changes have you seen at your hospital with those changes coming about?
Sure. So if you talk about Obamacare, the Affordable Care Act, what you're really talking about is the right for people to have insurance. The vast majority of the act is about guaranteeing coverage for Americans. We were the only country of all the industrialized countries in the world to not have health care as a right. And what Obamacare did was it created that right. So now what we see is many, many patients who historically did not have insurance, who either didn't access health care or accessed it through our county system or showed up at our doors with no ability to pay, now being insured. And so what sort of impact has that had on hospitals, not just Holy Cross, but hospitals across the nation? There's two big areas that it affected. The first is financially, to pay for the Affordable Care Act, for the country to pay for this insurance and the supplements and all, they've had to decrease reimbursement to hospitals. The theory being you're no longer seeing uninsured patients, therefore you'll get paid through their insurance plan. The problem is it isn't a even swap, and let me explain why. So during the budget crisis of the government a few years ago, they did something called sequestration, where they cut 2% of the reimbursement for all Medicare patients to all hospitals across the nation. Overnight, you have a 2% cut in your reimbursement. Now, I don't know about you, but we have a budget at home, right?
Yeah.
And we're going along fine. We know what our income is roughly if we're salaried, or at least even if we're not. And then all of a sudden you cut that by 2%. That's a big drop, and the government has not reinstated that. In addition, hospitals like Holy Cross get what we call disproportionate share funding. We get additional dollars to cover the cost of caring for the poor and vulnerable. They've been decreasing that sequentially year after year. So we have less money coming in from the federal government. Trauma funds have also decreased over the last few years, and they're shifting these dollars to provide insurance. However, there is no coverage for the undocumented population. And LA,
California has a problem more than anything. Probably.
Has a large undocumented population. And when the patient shows up at any of our doors, Holy Cross, any hospital, we're gonna do an exam, and we're gonna stabilize the patient before making any further, no matter what, no matter who shows up.
Yeah.
And so
you don't look at that. You look at this patient has a problem. We need to fix it.
Absolutely.
Yeah.
And we have to by law, quite honestly, but that is part of that is again our mission to care for the poor and vulnerable.
Yeah, I would hope so.
Yeah. So the problem there is there's no reimbursement for that. The money we used to get from trauma funds and from disproportionate share funding has gone down, and this is still an a significant uninsured population out there in the community.
Can I ask, so somebody comes in with whatever. What are you looking at in terms of? So you say it's an undocumented person. They don't. You find out they don't have insurance, but you already give them care that they needed. How much money is that's not getting back to the hospital? Am I allowed to ask that? Can I ask that? Because I'm just wondering. I don't know.
You can certainly ask it. I apologize. I don't have them out today.
Okay.
But
I guess it depends on the injury also.
Depends on the
Probably.
injury. It depends on the population you care for.
Gotcha. Okay.
So it's a variety of factors.
Yes.
Go into
way
that.
too many variables to worry about that. I was just wondering.
It's a significant chunk.
Okay.
Now the other way it's affected us is now you have a whole population of patients who previously had no insurance and are suddenly insured. Now they have a choice of where they seek their care. And so what we're seeing is a shift away from some of our county hospitals to the private community hospitals such as Holy Cross. So let me give you an example. In January, Holy Cross broke all records for ER visits. We historically see 280 patients in a 24-hour period. And that's great, and we're happy to serve. In January, we had one 24-hour period where we cared for over 400 patients. And so
good heavens.
that's a huge increase.
And that wasn't is that factored into, that probably wasn't factored in, is what I'm saying. Is it like the increase of, there's going to be an influx of people going to these emergency rooms?
I think that was a concern with the implementation of the Affordable Care Act. What you hope over time is these people get a primary care physician and they go to the primary care physician first. And obviously, always go to the ER if you think you have a life-threatening emergency, without a question. To meet this demand, we increase staffing and the number of physicians on board, and we still are able to see the vast majority of our patients within about 30 minutes, door-to-doctor time. And the communities know that, which is why we often hear patients saying, well, I drove by those other ERs to come to Holy Cross because I knew I could get in and out, versus at another hospital, I might be, in that time I get in and out, I'd still be sitting in the waiting room.
Yeah.
So we're very fortunate that we have such a phenomenal ER. In fact, our ER medical director will be coming to the Providence Hour in a couple months.
Oh, sweet.
Dr. Jason Fisher, fabulous guy. I think you'll really enjoy it.
I have been there. I have been. I was telling you guys during the break that my son had a staph infection. We went to Providence, and the bedside manner was fantastic. We did actually get, now that I think about, not in and out because they admitted him, but we did get in right away, and he was taken care of right away. So,
well, I'm glad to hear that. Yeah. That is our goal.
Yeah,
that is what we try to achieve. Yeah. So it's been a challenge. And I'm grateful that patients choose Holy Cross, and we definitely are here to serve. And we are actually looking now to expand our ER. We've already expanded it once a few years ago, and we're actually now starting the plans to see about expanding it again, so that we can continue to meet the needs of our community as their needs increase.
Fantastic. This is the Providence Holy Cross Hour on AM 1220 KHTS. Another quick break. More with Dr. Bernie Klein right after this.